Good, so we're here with Mrs. X, and we sort of discussed she has that increased lumbar lordosis, secondary to hypertonic paravertebral or erector spinae muscles, and increased hypertonicity of her iliopsoas. So we're going to gently treat those, as they might be tight, and we want to go very gently to start. So what we're going to do is we're going to have her engage her hip extensor muscles, like her glutes, by pushing her heels this way. So go ahead, gently push. Good, and relax. Good, and we resist. And so that flexes her extensors, right? She gets her extensors to fire, which should reciprocally inhibit, right, her iliopsoas muscle. And then, so through reciprocal inhibition, then we approximate the origin and insertion of the iliopsoas. Go ahead, push again, resist, relax, good. And then we do that again. Go ahead, push. Good, and relax, good. Deep breath in. Good, and breathe out. And we're going to do one more. So go ahead, pushing out. Good. Extensors fire, flexors release, iliopsoas relaxes. And now if you want to, you can go right into like a counter straight position here. And again, sometimes it takes 20 seconds, sometimes it takes 90 seconds, sometimes it takes 2 hours for these to release. So you have to have your hands in the right position, and you have to just gently feel this relax, right? So you sort of set it up with reciprocal inhibition by getting to relax, so usually the counter strain is going to go much more easier. Good. So iliopsoas is sort of relaxed a little bit, all right? Now let's sort of treat those erector spinae. So again, those erector spinae are going to keep that lumbar lordosis at an increased angle. If we gently bring her knees to her nose and we approximate that, okay? Good. So if we approximate knees to her nose, again, we have her fire her extensor muscles. So go ahead, push. Good, and relax. We bring her knee to her nose. You can see how the angle of her lumbar spine diminishes, and she gets the small of her back into the table. So go ahead, push into me. Good, and relax. Good. And do you feel a little bit of stretch in the lower back? Good stretch. It's nice, isn't it? Mm-hmm. Good. And go ahead, push out into me. Good, and relax. Nice. And go ahead, push into me. Good, and relax. Passive stretch. Good. All right, so we sort of gently got iliopsoas and erector spinae to be released. Now, while she's down here, we can show her 2 exercises that she can do every morning to help decrease that lordosis in her lower back. The first exercise is going to be you want to bring your hips, sort of tilt them up towards your nose. So sort of tilt. So hold on, here you go. So bring your pubic bone tilted up towards your nose. Good. Now hold it there. Now relax. Hold it there. Now push down like you're having a little bit of a bowel movement. Now you feel how your muscles tighten down there? That really tightens. So it tightens rectus abdominis, transverse abdominis. Now I want you to really tighten your glutes. So tighten your butt muscles. So hold there and tighten your butt muscles. Good. Nice job. And then relax. Good. So you see how that, when you do that, you see how it changes the tilt in your back. Good. And that's what we need to accomplish. So she can do 4 or 5 of those in the morning when she has time. Now she has 2 little kids that run around, so she's probably getting up running, so she probably doesn't have time to do this, but if she gets a spare moment, she can do that. The other thing she can do to sort of stretch her lower erector spinae muscles is to gently bring her knees to her nose and do that first thing in the morning, get those moving. Now she's lucky, her husband's a pretty big guy, he can help her in the morning, but he's busy too, he's leaving at like 4 in the morning, right? Yeah. So that's a good way to do that. So we're helping her, and then she's doing things in between to help get those muscles into a better perspective. Good, thanks.